Hello everybody, this is Hassan Rafid, your anatomy and physiology instructor at Madison College in Wisconsin. We're going to talk tonight about the anatomy of the heart. The heart is a muscular organ. The heart is located central in the thoracic cavity and it is deviated to the left. So, for reality, the heart is located in the center of the thoracic cavity but it's deviated a little bit to the left. That's why some of us think or believe that the heart is on the left side of the chest. The heart contracts to push blood into the arteries and relax to let blood come back to the heart by the veins. The heart has rooms or chambers and it does have walls and it does have vessels that comes out of the heart, and these vessels are divided into arteries and veins. We know arteries carry blood away from the heart and they carry oxygenated blood, while veins bring blood to the heart and they bring deoxygenated blood or blood that is poor in oxygen. Let me show you the structure of the heart. This is called the heart of America and we use it as a model to show you the anatomy of the heart. If you take a look at the surface anatomy of the heart, you see some vessels running here, blue and red. These we call them the coronary vessels or coronary arteries and veins. I'm going to show you here, this is the left side and this is the right side. What you see here is the right coronary artery. It runs in the sulcus between the right auricle and the wall of the left ventricle. On the left side, you see the left coronary artery. And the left coronary artery will give branches. This is called the circumflex artery, and this is called the anterior interventricular artery because it runs between the two ventricles. This is the left ventricle and this is the right ventricle. So what you see here is your interventricular artery. The heart has 4 rooms, 2 ventricles, left ventricle and right ventricle, and 2 atria, right atrium and left atrium. The atria are separated by valves. What you see here, this is your tricuspid valve and this is our mitral valve. So the mitral valve separates the left atrium and the left ventricle, while the tricuspid valve separates the right atrium from the right ventricle. The 2 atria here and the 2 ventricles are separated by the interventricular septum, this thick wall, and the interatrial septum, which is a little thinner. As you noticed, the walls of the ventricle are more thicker and more muscular. This is just due to the fact that the ventricles work harder to push blood into the circulation against resistance. If you take a look at the heart, it looks like a triangle roughly. So this is called the apex of the heart and this is called the base of the heart. So what you see here, a little broader, this is the base of the heart, while this is the apex of the heart. All right. On the top here, you're going to see the great vessels that comes into the heart or leaves the heart. We have the blue one or the veins, and these are the pulmonary branches. So this is a pulmonary trunk. This is a pulmonary trunk, and the pulmonary trunk will give you left and right pulmonary arteries. So we have the pulmonary trunk, we have the left pulmonary artery and the right pulmonary artery. This is the arch of the aorta. It looks like an arch if you look at it here. This is the aortic arch, and the aortic arch originates from the left ventricle. Let me turn it around like that so you see it. And it gives off branches. It gives the brachiocephalic branch here, common carotid, and the left subclavian. And it goes at the descending aorta, which will go into the chest and is known as the thoracic aorta, and goes to the abdomen, and it is called the abdominal aorta. This part of the heart is known as the auricle. If you see, it looks like an auricle or an ear. And this is located in the right atrium. I want to also show you inside the right atrium, there are some structures that are important here. We have the opening of the coronary sinus, and also we have the sinoatrial node. And the sinoatrial node is known as the pacemaker of the heart. That is where the heartbeat or heart contraction is originated. Behind the heart, if you see, that is the trachea and the other structures. So the heart is kind of located a little bit more anteriorly to the aorta. The heart is located in the space between the two lungs that is known as the mediastinum, where you see the heart and the great vessels. I hope to see you next time in the next session of our anatomy and physiology. Thank you.